5 on your health tonight. A holiday warning about heart attacks. Research shows they kill more people in the month of December than any other time of year. Here to explain is Dr. Ali Raja, Deputy Chair of Emergency Medicine at Mass General Hospital. Good to see you, Doctor.
You too, Jessica.
Dr. Raja, the American Heart Association says there are several reasons why December is so deadly. So what's on that list?
You know, Ben, it could be a couple of things. It could be related to the fact that we're all just more stressed and running around with less sleep and higher blood pressure. But they also talk about the fact that travelers often forget to pack their medications. And so we really need to make sure that when we're traveling out of town, we do that. But then also, it's really important to remember that even though we've all got a million plans and a tight schedule on the holidays, if we start feeling signs of a heart attack, we can't ignore it. I'll often see patients in the emergency department who come in having had symptoms for a day or two because they were just so busy during the holidays. That is really a bad idea. Come on into the emergency department if you're feeling bad.
That's good advice. And, you know, do heart attacks typically happen just all of a sudden, or what are the warning signs that we should be paying attention to?
You know, both can be true, Jessica. You can have a heart attack all of a sudden, but as you said, there are often warning signs. It can be chest pain. It can be sort of a squeezing in the middle of your chest, especially if it goes up to your neck or your arms. But sometimes, and this is especially true in women, heart attacks can actually present without chest pain, and you can have nausea or shortness of breath or lightheadedness. So if you're feeling any of that, it's important to call 911.
All right, so if we are at a holiday event or a party and somebody says they are having chest pains, what should we do before the ambulance arrives?
You hit the nail on the head. So, Ben, the first and most important thing is getting that ambulance on the way, having somebody call 911 and getting the ambulance coming. Once that's done, you can get the patient either 1 full size or 4 baby aspirin, unless they've been told they shouldn't have aspirin for some reason. If there's an automatic external defibrillator nearby, it's a good idea to get it. You probably won't need it, but it's better to have it handy. And aside from that, just stay with the person, keep them calm, and help the paramedics know where they are when they actually arrive.
Great information. Dr. Raja, we always appreciate your insights.
Thanks, Jessica. Thanks, Ben.
Thank you.
Thank you.